All right, for this lecture, we're going to talk about diagnosing infectious diseases. We've got the introduction. We're going to talk about how you get clinical specimens and the roles that different healthcare providers would be involved in this, and why you need to keep these specimens clean and accurate. And then we'll talk about the different people who will use these to diagnose infections. Obviously, this isn't a big part of your practice, so we're not going to spend a ton of time on it, but we'll go through this and learn most of the information that you would need to pass a board and also to be a good clinician. So proper diagnosis of infectious disease requires you taking a good history. The history leads to most of your answers anyway and most of your diagnosis. You have to do a good physical exam on the patient, looking at them, touching them, listening to them, and evaluating their signs and symptoms. And then you have to figure out what you need to get as far as any sort of tests. So the things that we typically collect from patients could be blood, urine, feces, cerebrospinal fluid, saliva. These are all the specimens that we get. And they are, if you work in a hospital setting, they'll be submitted to a microbiology lab in the hospital. In addition, they will also collect things like bone marrow, bronchial washing, sputum, vaginal or cervical swabs, nail clippings, hair, pus, you name it. If it can be tested, they will use it. And the most important thing here is to just make sure you get a high quality sample if you're going to do this. So the role as a healthcare professional, you have to have a working relationship between you and the members of the pathology team to get a good diagnosis. And if you collect or transport the specimens, you need to use caution while doing so, so you don't infect yourself, but also so you don't contaminate the specimens. And typically, if you are handling a specimen like this, you will be using universal precautions or standard precautions. You assume everything that you're dealing with is severely infected and could give you any disease you could imagine. The lab professionals don't make the diagnoses, but they actually get the test results that the clinicians use to make these diagnoses. So a good specimen is required, and basically this means you have to pick the right specimen. You have to actually collect it appropriately and transport it appropriately. Usually, if you are working with an outside laboratory, they will give you a policies and procedures manual that tells you how to get every sample appropriately and how to not only collect it but store it until it can be picked up or transported to the labs. So you have to pick the right specimen, you have to get it the appropriate way, get it from a site where the pathogen will most likely be, and then the specimens should be obtained before you try to start antimicrobial therapy, just because, well, if you've killed off the specimen, you might not get the right results. The acute stage of the disease is the most appropriate time to collect the specimen because that's usually when you're going to have the largest bacterial or viral or what have you load. Specimen collection should be performed with care so that you don't hurt the patient, and also so you don't hurt yourself or infect yourself. Sufficient quality of the specimen has to be gotten so that you can do all the tests you need. Once you've got the specimen, you have to put it in a sterile container so that the container doesn't contaminate the specimen. And it should be stored at the right temperature so that heat and cold and other things like that don't affect it. Hazardous specimens should be handled with even more care so that you don't hurt the person that's delivering it, the person that took it, the person that's storing it, anyone involved in the chain of transfer. When possible, those sterile disposable specimen containers should be used so that you don't, again, cross-contaminate and get other things into the sample. The specimen container should be properly labeled and accompanied by the request slip with the right instructions. This basically makes sure you've got the right specimen from the right person for the right test. and they should be collected and delivered to the laboratory as quickly as possible so that there's time to process it and use the information. Blood is one of the more common specimens we collect. It should be sterile. If you have anything in the blood, you have septicemia. If it's bacteria, we call it bacteremia, but septicemia means that you have some sort of an infection that is in the bloodstream, so the bacteria and their toxins or other things could be causing a whole bunch of signs and symptoms: fever, chills, pain. To prevent contamination of a blood specimen with your own skin's microbes, you need to use aseptic technique, which in large part includes gloves and antiseptics. Quite often whole blood will be spun down, and you will see a whole blood looks something like this when you spin it, or when you let it sit for a long enough time, the plasma will actually separate from the blood. When you want to actually take the sample, you find the vein that you want to work on, and you start right on the spot you want to draw from, and then you do that spiral action that you're seeing in this image. And the reason you do that spiral action from inside to outside is so that if there are any microbes there that the alcohol or the iodine isn't killing, it's actually moving it away from the area you're going to puncture. You've all had blood taken from you, so I'm sure this is not a new thing. You know what it looks like, you know what it feels like. Here's a nice picture of it. And these are one of many different blood culture systems that are up there. Urine. Urine should also be sterile in the bladder. Now, as it passes through the urethra, it could become contaminated by bacteria on the distal edge of the urethra. In order to do this, you typically tell patients to give you a clean catch midstream sample. It means you let them actually urinate a little bit of urine before they collect it, because this will remove pathogens. Urine could involve a colony count, which means they're going to take a sample and use a loop to spread it onto a petri dish and see how many colonies they grow. That tells you how many original bacteria you probably had. You can isolate and identify the pathogens or do antimicrobial susceptibility testing. The colony count just is a way to estimate the number of specimens, and then basically you take this and you use it and you inoculate a plate, incubate it overnight, up to 48 hours. The colonies are counted, and then multiplied by the dilution factor. So here's what it looks like. We take a sample from the urine, put it on a plate, and then count the colonies that you've got. Cerebrospinal fluid is a body fluid we will do in cases where we believe there is an infection of the central nervous system. Meningitis, encephalitis would be reasons why we would do this. The cerebrospinal fluid, again, should be sterile. So if it is not, whatever's in there could be causing damage to the brain and the spinal cord. This is actually collected by doing a lumbar puncture. This is done not by a lab tech or somebody. This is done by a physician. The procedure is a very, very specific one. It has to be aseptic, and it is an emergency specimen because the diseases that it could be diagnosing could be killing within hours. This is an image of the lumbar puncture. Unfortunately, the image actually shows the needle going through the wrong place. It should actually be going between the 4th and 5th lumbar vertebra. This is the proper position. The patient would be side lying with their knees at their chest, which would give you the best access to this. Sputum is pus that accumulates within the lungs of a patient. So this would be something you would find in pneumonia, tuberculosis, other lower respiratory tract infections. Sometimes they're just, the sputum samples are just saliva with mucus in them. Saliva doesn't really give you clinically relevant information. If you are suspecting TB, you need to be very, very careful because it is highly contagious and it survives in the open for quite a long time. Bronchial aspiration or transtracheal aspiration will usually give you better results of sputum than actually going through the mouth. Throat swabs, you've all probably had this done. It's a way to test for strep throat. Specific cultures are also used, say, to see if you have Neisseria gonorrhea causing an infection or Corneobacteria diphtheriae causing infection. We'd also take wound specimens to see what's in there. Aspirated, we're taking pus out by a needle rather than a swab, just because that's more likely to be a clean catch, a clean specimen. Specimens that you use a swab with are often contaminated by the skin's own flora. Gonococcal cultures are interesting bacteria. They are fastidious, which means they need lots and lots of nutrients to grow. They like small amounts of oxygen and carbon dioxide. So you have to grow these in special, you have to collect them with special tools. You have to grow them on special media and incubated in a carbon dioxide incubator. So in other words, these have to be treated very, very differently than most. There's a nice little image of that culture. Fecal specimens, so stool samples basically, collected at the laboratory, processed immediately so that you don't change the temperature or change the pH, which would cause the death of a whole bunch of things that might be causing infection, or at least the decrease in count. Bacteria in fecal microbiota are typically anaerobic or aerotolerant bacteria. They are, we do all sorts of tests, microscopic examination, biochemical tests, immunological tests, to see what these are. And this is also a way to get worms and parasites in your samples. Clinical specimens get submitted to the clinical microbiology lab, which is part of the pathology department. The pathology department is basically run by a pathologist or a group of pathologists, and they actually will do a number of tests. The anatomical pathology is looking at tissue samples, where the clinical pathology is doing lab tests and seeing what those results are. So you can see here this nice little rundown. The anatomical pathology could include the morgue, the histology lab, the cytology lab, whereas the clinical pathology is chemistry and hematology and immunology. So when we look at diseased organs, we typically stain their tissues and look at the tissues to see what they look like. There are texts that get the slides ready, and then the pathologist actually looks at the slides and determines what is wrong. Clinical pathology is looking at the chemistry, things like urinalysis, blood tests, doing immunoassays and other things like that. And again, you usually have pathologists, chemists, and microbiologists, as well as medical lab techs in this department. And you are generally going to have the whole department under the direction of a pathologist. A microbiologist may be involved, but most often it is a pathologist. The primary mission of the microbiology lab is to assist the clinicians in diagnosing infectious diseases. So basically, you're going to process clinical specimens, isolate pathogens from them, identify the pathogens, and in many cases actually perform antimicrobial susceptibility testing. So that would actually be figuring out what antimicrobial might be useful in treating this infection. The ones, when you specifically are dealing with bacteria, you call it bacteriology. The bacteria pathogens are isolated from the specimens, tests are performed to identify them, and susceptibility is done. So basically you get to be a detective if you're doing this job. You use all these different tests to figure out what the microbe is. If you were to take a 4-credit undergraduate microbiology class, I can guarantee you there would be a lab where you would use all the different tests you had learned to figure out what the unknown specimen was. Basically, you get a specimen, you look at it macroscopically, you gram stain it, you inoculate it, you do all sorts of things to look at this, and then figure out what the pathogen is by that, and tell the clinician. And basically, like this says, you are trying to figure out what's causing the infection by gathering clues. What does the colony look like? What media does this grow on? How does it affect the media? What do the colonies look like? And here you can see somebody doing that. And here you can see examples of biochemical tests that they might do. We are not going to go over all of these. That would take way longer than the time we have allotted. But you can actually see one of the tests that we'll often do is a test for hemolysis, and that is whether or not the bacteria will eat blood, and if it does, what type of hemolysis do you see? In this example, it's actually showing you alpha hemolysis, in which that ate blood, and it actually created a different colored ring around the colony, whereas beta hemolysis, it ate the blood and actually just totally disintegrated the blood, left a clear ring in the media. In a microbiology lab, you may have a mycology section. That's the one that's looking at fungal infections. And so these are processed basically in the same way as the bacterial ones, but now you add things like hair and nail clippings and skin scrapings to the pot, and you may actually be using other medias. Potassium hydroxide preps, tease mounts, certain biochemical tests for specific yeasts, or other tests for molds. This is a colony of mycelium, or a column called a mycelium of Aspergillus species. Remember, this likes to grow on peanuts, and it also will grow on certain fruits. And here's a penicillium species, the thing that gives us penicillin. Here's some fungal hyphae in a stained heart valve specimen. So this person had some sort of endocarditis or heart valve infection. In addition to those departments, you may also have a parasitology section, which is looking at parasites, amoebas, giardia, worms, all sorts of other things that might be causing infection. And the virology section, which helps to diagnose viral diseases. Usually this involves immunodiagnostic tests, and electron microscopy. There may be virus isolation in certain cell cultures. Here is a picture of part of a brain that has been infected with rabies, and this is the normal nucleus. This is what's called a negri body, or a black body. This is a sign that somebody has rabies, and it has moved to the central nervous system. Here are some other versions of a similar test. And then lastly, you've got the microbacteriology section, or the TB lab. Basically, they're worried about TB. The two most common mycobacteria infections that we worry about: tuberculosis, which is serious, which is deadly, and also leprosy, Mycobacterium leprae. Both would be using this section of the